All right, I think we're going to get started. I think people will continue to filter in, but welcome everyone to Building Your Village from Pregnancy to Parenthood. We are doing this in partnership with Women and Infants. We have amazing midwives from Women and Infants that are going to be speaking today. And this is a series that actually myself and Liz Howard developed back when COVID happened. There was a lot of challenges getting education. And we saw that it really helped thousands of families to have webinars, make it very accessible to get this information. So we're kicking off the Flourishing Family series again. We're so excited that you're here. Again, whether you're pregnant, you're trying to conceive, you just recently gave birth, we're going to have topics that are really relevant to you. We're going to be talking about how to be proactive. How do you build your support team? And your support team is not just your clinical team. That's a big part of it. There's also community-based care, there's social workers, there's partners, there's medical providers, there's family. If you have family nearby, they play a really crucial role in supporting you from pregnancy through postpartum. So we're going to be talking about all of that today. Just to give you a little bit of background on the hosts, as I mentioned, myself and Liz Howard at Women and Infants, we started this series back during COVID when people were unable to get access to education, and we saw such a big need for it, and so many families that were asking hundreds of questions. Speaking of questions, we would love to hear from you. So if you want to jump in the chat, tell us where you're calling in from. Tell us, are you pregnant? What information are you looking for? We'd love to really make this interactive. The goal is for us to be sitting in your living room with you, essentially. That's the way this is supposed to feel, is that we're just a friend talking to you about what your needs are and ultimately helping you get access to resources. So drop a line in the chat, and then any questions that you have throughout the entire series, just drop it in the chat. We'll make sure to address it. We may wait till the end to answer the question, but as you have the question, please just drop it in the chat. So just real quickly, my name's Melissa Boley. I'm the CEO and founder of Flourish Care. I started Flourish Care after having my two boys, who are now 7 and 9. It feels like just yesterday. And having somebody actually mentioned to me potentially getting a doula. I did not know what that word meant. I didn't know anything about doula care back 9 years ago. And I ended up having an incredible doula for both of my births. And it really changed my life, changed my career. So ultimately, we started a maternal health care company that really empowers families with wellness programs and doula care that's supported and covered by insurance most of the time, which is great. We've been advocating for more insurance coverage and really trying to help patients and families through pregnancy, early pregnancy, all the way through 12 months postpartum and early parenthood. Liz, she's going to be doing an introduction of herself when she speaks later as well, but she's a midwife at Women and Infants. She's also a professor at Brown, and she's got amazing experience both from the clinical side, also from the education side, and she's a Watson Caring Science Institute postdoctoral fellow. She's got all the knowledge. We've done a clinical study together, and the amount of information she has around how to really support patients and how to look at things like self-efficacy and advocacy for patients is really, really amazing. So I'm excited to have her talk today. This is just a quick agenda, so we're almost done. Welcome and introductions. Don't want to take up too much time. Then we have the most amazing keynote speaker, Anna Sophia, who's also a midwife at Women and Infants, and she's going to be introducing herself, talking about how you really want to build your team, how you can advocate for yourself as a patient. Then we'll talk about the need for a doula. We get a lot of questions, actually. We really started supporting patients about a year ago through insurance, and we get tons of questions from patients on, I have an OBGYN, do I need a doula? I have a partner, can he be a doula? So we'll be talking about, what the roles are of different people within the birth team. I'll be talking about what's covered by insurance, what you need to know. These things change all the time. So what does insurance landscape look like today? How are things changing going forward? The ins and outs of birth supports. We have an amazing doula that's part of the Flourish Network that's on, Bridget. And she's going to be talking about what birth support looks like. And then Ariel and Carl are parents who actually gave birth during COVID. And then again, just recently, and just talking about the differences in what that team look like, having doula care there hands-on versus not, And then we'll be talking about the fourth trimester, navigating sleep and recovery postpartum, which is very, very critical, and making sure that you're taking care of yourself during pregnancy and then again postpartum. We have amazing giveaways. We will be raffling off. I don't know if that's the right word, but we'll be sending out some of the folks on today. You'll be entered into a raffle for these gifts. We've got all the baby senses, bonding and baby wearing, and get that liquid gold, which is supporting breastfeeding. So excited to announce those winners after the event. And as I mentioned, we have an amazing keynote speaker, and then we'll be followed by our panelists. So with that, I'm going to turn it over to Ana Sofia. Thank you so much. And we're so thrilled to have you here. And we're really grateful to our panelists and women and infants for partnering with us on this series.
All right. Hello, everyone. Good morning from wherever you are. I'm coming to you from Los Angeles, and I hope you're having a wonderful morning. So I wanted to get started right away. So welcome. My name is Ana Sofia Barber de Brito, and I'm a certified nurse midwife at Women and Infants Hospital as well, right, working with Liz as part of the academic division of obstetrics and gynecology. I don't work in the outpatient setting, seeing patients as part of my own patient panel anymore, but instead I work in the emergency department, antepartum, labor and delivery, and postpartum. So if you happen to give birth at Women and Infants Hospital with the practices who deliver there, most likely we might meet. And I'm also a parent to an almost 5-year-old, and my birth story is an integral part of who I am. And birth becomes part of your story as an individual for the rest of your life, and for those you allow to enter into your space as well. And so today we are here to discuss the act of building your village, or as I would like to call it, your birth and wellness community. So some of you may just be starting to think about what this means to you, and you might be thinking along the lines of, who will be at my birth? Is it my mom, my dad, my sister, or my partner, or whoever it may be? And others might have already built a robust community made of family and friends and other supplemental care givers such as doulas. And today I want us to think in the most idealistic terms about what can be our birth and wellness community. Allow yourself to imagine optimal wellness. Imagining and dreaming is radical, and it's so important for your pregnancy and your postpartum journey. So today you'll hear from our guest speakers on doula care, how to fund a doula in Rhode Island, sleep wellness in the postpartum period for yourself and your infant, as well as a tale of two births, reflecting on the differences of birth in isolation during COVID and birth in non-isolation or with support. So as a midwife, I like to think about pregnancy as a time where you are most aware of your ever-changing body. Your senses might be more sensitive. You're feeling the kicks eventually of the new and forming human in your body. Some of these are welcome changes and some are not, like nausea. And during birth, I like to think of the journey as one between the veil. So when you're in actual labor and giving birth, it's one of the only times in your life where your body is alerting you to pain, but you are safe and undergoing a normal physiologic process that simultaneously places you in a space between life and death, both figuratively and literally. That death can signify the death of you as an individual, becoming a parent, and so many other metaphors that can come from giving birth. And this can be one of the most sacred journeys that you put your body through. Although I am speaking about the gestating person as an individual, the pregnant person is nonetheless connected to their immediate family, right? So whether that's your partner or your family members and your neighborhood and the larger society. And it is incorrect to think that you are doing this alone, that you are an individual in this birth experience. And it's also incorrect to assume you should be going through this alone. So I also wanted to share a little bit about my story of becoming a parent. So before I became a parent, I was already a midwife for a couple of years and had a deeper understanding of pregnancy discomforts, labor, birth than most people, I think, who become pregnant do. But despite all my preparedness, giving birth and becoming a parent consistently surprises me, still to this day, almost 5 years later. And if it weren't for my community, I wouldn't be here today, literally. And so today I'll walk you through thinking about your community and wellness by starting the discussion on who comprises your health team. Most of us find ourselves in the position of choosing our OB-GYN or obstetrician gynecologist based on the same person in clinic we saw who performed our first pap smears. We believe that this is what we have to do. We don't shop around. We ignore our own philosophies and ideas that have guided us through life. We spend more time researching and choosing a car, I think, than choosing a birth and pregnancy practitioner, which always makes me wonder where we're putting our most concerns in our life. And so choosing your birth team is an important aspect of your pregnancy and birth journey. In the United States, midwives perform right now about 10 to 12% of births in the United States of America, so all of the USA. And so it can be difficult to find a midwife based on where you are in the United States, depending on the region. But here in the Northeast, we do have a lot of midwives. And in Rhode Island, we have a robust workforce of midwives that we're increasing. And most people don't know what we do, or they have an idea of us as this crunchy, hippie herbalist practitioner who only do home birth. And although that is a facet of midwifery and can be the midwife you want, we are also, especially in the Northeast, embedded in the healthcare system as it stands. We are medical practitioners, knowledgeable not only about birth, but the reproductive system, and can be found in clinics, hospitals, and in Rhode Island, we are independent practitioners. There are certified nurse midwives, certified professional midwives, and midwives who work in various settings, home birth, birth centers, although we don't have a birth center, a standalone birth center here in Rhode Island, but we do have the alternative birth center at Women and Infants Hospital. And we have midwives in the hospitals, or those that you see in the clinic who then deliver mostly in hospitals here and around Rhode Island. And if you are wondering where, so Women and Infants, Landmark, South County, those are the three in Rhode Island that have midwives working and practicing. Kent Hospital, unfortunately, does not have any ones. And if I'm missing one, please drop it in the chat as well. And our philosophy to birth care is a holistic attempt at navigating you through the healthcare system and meeting you where you're at and attempting to protect normal physiologic birth, which is allowing your body to do what it needs to do and intervene as needed. Many people think that you can't get an epidural with midwives, and that is not true. We can help you prepare for that as well, if that's the need. And then many pregnant individuals have stated midwives spend more time with them, educating them about their bodies and pregnancy and taking care of them mentally during the postpartum period as well. And it's important to ask yourself, what is important to you? Is being heard at your prenatal visits and not being dismissed important? Is feeling educated and knowledgeable about your body and pregnancy super important? Is understanding normal so that you can know abnormal important for you? Is feeling aligned with your birth choices and not having to fight for every choice you've made or want important? Is having your partner be included in your prenatal visits and part of your care important as well? These are all questions you should not ignore as you choose your medical and birth practitioner. And if at any point your medical provider does not align with you or you feel dismissed and unheard, you have the right to dismiss them as well and find someone new, no matter where you are. It might be more difficult in the third trimester when you're 38 weeks, 39 weeks, but you can move on and find someone else who is better suited to care for you. So great. So now you have someone who will safely guide you through the physical changes of pregnancy and keep you safe and detect abnormal qualities in your pregnancy. But we have to think beyond the physical. Mental preparation for birth is an important aspect that often goes without acknowledgement. You wouldn't show up to a marathon without months of preparation and running and fortifying yourself physically and mentally for 26.2 miles, right? And that's the same thing that I ask of my patients when I was in the clinic, that we prepare while we're together for about almost 10 months. Why don't we prepare mentally for what you are to expect, what you need to know, how you're going to feel? We can't predict everything, but we can prepare mentally for this arduous labor process, right? And if we're not preparing, then why are we asking ourselves to do the same for the marathon that is labor and birth and postpartum? The United States of America healthcare system is lacking. We know that. And until that is changed and we have more holistic care for all pregnant individuals, we have to take it upon ourselves to prepare our community and wellness team. So let's start with the prenatal period. We can add physical therapists, acupuncturists, lactation consultants, nutritionists, prenatal yoga as supplements to our westernized concept of prenatal care. But we mustn't forget community. A group of pregnant people sharing their stories and going for a walk does wonders to the body and soul. And sharing our stories and our experiences helps strengthen our understanding of pregnancy, as has been done for millennia between women and pregnant individuals. We learn from one another, and nothing can replace wisdom handed down in community, not even TikTok or Instagram. Because what might work for one person on TikTok doesn't necessarily mean it's a life hack for all. And instead, we are chasing social media standards as opposed to real lived experiences. And so, in this same breath, a doula can supplement your mental preparation in an increasing medical world that is lacking prenatal education. A doula is an emotional coach, not a medical practitioner, but and depending on their skills, can come with various education opportunities to help prepare you, your partner, and family members. And luckily today we have Liz Howard, who will continue the conversation on doulas, and Melissa, who will guide you through how you can get a doula through insurance and funding. And we actually have a doula in our panelists today who can speak to you about the ins and outs of what that entails, and why having a doula allows you to focus on your bodily experience in birth and your partner to focus on their experience and ascent to parenthood, instead of continuously advocating and interrupting the physiologic process to deal with the demands of a healthcare system. So a lot of times you're in the groove, you're doing the things that you need, all the things that you practice, the positions, working through your contractions, and all of a sudden you're interrupted by something that you had already stated in your birth plan that you didn't want, such as an IV, and a conversation around that. And a doula can sort of say, well, we talked about that. And not interested in putting an intravenous IV into their hands and all of that. So doulas can help navigate that system that continuously interrupts the whole physiologic process and help advocate for things that you've all already prepared for and discussed. There's a lot to discuss about pregnancy and the birth experience and postpartum. So allow that person to guide you through that. So great, the birth happened. Now what? You had a great healthcare team. Now you're a parent, or twice or thrice a parent in your home. It's the fourth trimester, and not only are you recovering physically, but the mental health aspect is of utmost importance, and we also have to take that very seriously as well. Taking care of a newborn is demanding. It's ungrateful work. Your hormones are crashing and equilibrating. You're demanding your body to make a new substance, breast milk, if you choose to breast or chest feed. You're navigating sleep deprivation, maintaining your relationships with your partner or attempting to maintain them, family and friends. There's lots of dynamic working there. People want to visit. You don't want them to visit. You want them to take care of you, but they're so focused on the baby. You may be returning to work way too soon and attempting to make sense of whether my infant should sleep through the night at 2 months old or not. And why must they wake up every 2 to 3 hours? You're sleep deprived. It's tough to think you can do this alone. So I want us to take a moment and again, utilize that imagination and radical thinking. And imagine a world where all you have to do is lay in bed and attend to the demands of an infant, because that's what they're there for. They're there to make sure that they're surviving. They need to be fed and they need to be changed, and they want cuddles and warmth and love and feeding, changing, and sleeping with them while others feed you, do your laundry, give you sleep breaks, allow you to reconnect with your partner in this ever-changing portion of your lives. And in some cultures, they do exactly that. In Eastern cultures, people who have just given birth are taken care of by the community for 40 days and 40 nights, and they must stay warm and recover. But here in our westernized world, we don't always get that. We're very much in a rat race, and we're going, and some employers probably haven't even given you time to recover before they're asking you to come back to work. Or our laws that we have don't respect the need that you are, a lactating person who needs breaks and time to get your supplies together and pump and do all of the things. It's a lot going on. And so in my own experience, I was gifted a doula at the time, since in 2019, doulas were not covered by insurance. And I declined the full spectrum doula and opted to not get a postpartum doula because in my mind, I had this. Unfortunately, I did not have this. The people I had as my team had to go back to work within 1 to 2 weeks in my postpartum period. I was alone with an infant who was gassy, didn't sleep a lot, was very hungry, cluster fed, I was sleep deprived and without anyone else to speak to. It was literally me, the infant, and the Great Baking British Show, or the Great British Baking Show. That's what it's called on the TV, as I struggled through the immediate postpartum and the postpartum period as well. And I began to develop postpartum depression severely. Luckily, I had my therapist from my pregnancy and my midwife to catch the depression through screening and get me to appropriate resources, as well as a postpartum group that I joined on a whim at 6 weeks postpartum, that brought me back to life. And those women are still my WhatsApp moms group. We're still with each other. It's almost 5 years later, and we're still supporting one another. They came to my home and prepared meals and fed me so that I could sustain myself and continue to produce breast milk, which was something I really wanted to do. And I was able to do that for almost 2 years. And I did have a doula during my birth. I actually had two, as one was an apprentice, which, although I didn't choose the postpartum package at the time, they did come by and check on me multiple times in the postpartum period, even though I didn't pay for that. And my therapist that I had, and the midwife and the friends who knew when to come by and take the baby on a walk or wash some dishes or throw laundry in the machine. And so without these community links, I'd have to navigate all of these changes by myself. And it was hard. And it took a while for me to bounce back from postpartum depression. I would say that it lasted for about a year, and then generalized depression and navigating parenthood and understanding all of that. And I was so grateful to have this established team of people I could lean on and share and vent and talk about all of the concerns that I was having. And being a new parent is hard. You don't know what's normal. You're always in the pediatrician office. You're always Googling. You're on Instagram scrolling in the middle of the night, 2 a.m. while you're breastfeeding. It can be very difficult, and you're getting so much noise from different things that you don't know what is real and what is not, and what you should focus on. And so, from today's guest speakers and my own story, I want you to begin thinking about your needs and the support you think you may require. Not everyone needs all of the things mentioned, but what is most important to you? Are you a person who loves sleep and knows sleep deprivation, like myself, will make you into a subhuman? Then hire that sleep consultant. Ask a friend or family member to take the baby for 2 hours so you and your partner can nap. Do you want to be able to focus on your body's needs during labor and understand what you are going through while being supported, and have someone there to remind you that you are safe and secure? Then hire a doula. And luckily in Rhode Island, where we were the first state to pass private and public-based insurance to cover doulas. So utilize that resource. And then think about who is in your community and how you can lean on them. We cannot do this alone, and we are not supposed to. So think about all of the things that make you who you are and what you need and who can help you with that, whether it's a meal train in the postpartum period, whether it's getting set up with a therapist now while you're pregnant, or conceiving or thinking about becoming pregnant, and working through what does parenthood mean to you? How do you want to be a parent? What does going through labor mean to you? How can you connect with your body? Whether it's a chiropractor or an acupuncturist that can help you with pain or discomforts that you're feeling in pregnancy. There are so many resources out there, and we're not told about them all. And so take this opportunity to really listen to what everyone is sharing today, and take notes and talk with your partner if you have one, or your family members, or sister, or another person who's gone through pregnancy, and start making that plan, because this is an important part of your life. It's going to be with you for the rest of it. You're going to think back to your birth story forever. So make it a good one, and make it one that you remember with fondness and not with a lot of trauma. And so thank you for listening today. And I want to turn it back to the folks so we can get to hear from all of our other wonderful panelists today.
Thank you, Anna Sophia. And I really appreciate you sharing your personal story. I know that's not an easy thing to do, but like you said, community and being able to talk to other people who have been through these experiences, especially someone like you who's had all those resources and knowledge around this space. None of us are immune to what parenthood brings, right? It's really getting proactive and being in these spaces, making sure you have access to the resources ahead of
Right.
time so you're not drowning in that period. So I just really, really appreciate you sharing your story. And I think it's very, very impactful. And I'm excited that we'll be able to share this out with everyone as well. And one thing that I think was really important, two things. One was the marathon. Training for a marathon is no different, right? So
Right.
I love that analogy. And then I think number two is this is standard of care in almost many other countries, Europe, the
Mhm.
East. Like, this is the way mothers are prioritized in those societies, and their outcomes are better because of it. So I
Right.
really don't think people need to think about these things as a luxury. These are just resources that you're going to need to lean on, and you really want to be prepared up front. So I really, really loved the talk. I'll turn it over to Liz. Please, everybody, pop your questions into the chat. There's also a Q&A. I'll be checking both of them, whatever's easiest for you. But with that, I'll turn it over to Liz, and we'll continue on with the series. Thank you.
Thank you.
Great. Thank you, Anna Sophia, and thank you also, Melissa. And Melissa, if you could share our slides, that would be terrific. I'm Liz Howard. I'm the Chief Clinical Officer for Flourish Care, and I've been a midwife for 35 years. I've been at Women and Infants as a midwife for 20 years, and we're really excited to reignite this series. We found that during the pandemic, families really needed information on how to navigate hospital systems through pregnancy as well as parenthood. And so we're really happy to bring to you Building Your Birth Team, Why You Need a Doula. I am so fascinated in how families get ready for parenthood to make that transition. And I always think about how in nature, birds really seek out diverse elements to build a nest, to make something that's both flexible and strong that weathers the elements. So I really want to talk to you about what different members of the birth team do and why having a doula really enhances the care that's provided to you during pregnancy, whether you're giving birth in the community, such as at home or in a birth center or in the hospital. So first, let's just do a little definition here. So what is a doula? A doula is a trained non-clinical professional based in the community who provides continuous education, physical and emotional support to birthing people and their families before, during, and after childbirth to help them achieve the healthiest, most satisfying experience possible. Birth is an experience that everyone should feel good about, should feel prepared for, and supported. And adding a doula to your birth team, whether or not you have the best nurse, the best physician, the best midwife, will enhance the care. I really believe in that. A study that was done back in 2001 in Women and Infants was actually one of the hospitals included in a randomized trial on nursing care, whether or not one-to-one nursing care was the same as continuous labor support. And what they found is that while one-to-one nursing care is optimal, it does not give you the same kind of support as a non-clinical support person providing you support in your pregnancy. And that's probably because nurses, just like midwives and physicians, we also have other tasks that are related to your physical care to focus on. So adding a doula, if you could go back, thank you. Adding in-person doula care will actually show you some incredibly robust outcomes. There's actually nothing better studied in obstetrics than doula care. It will lower the preterm birth rate. It will reduce the need for pain management. It does not mean you cannot choose pain management. You can have an epidural, but it does show in randomized trials that the need for pain, like such as morphine, epidurals, is reduced. There is an overall reduction in depression and anxiety. There is an increased rate of breastfeeding. There is a decrease in neonatal intensive care rates by 50%. And of course, most costly, it lowers the C-section rate by 30%. So lowers the cost to you, to the healthcare system, and to the public health system. It also is being shown to reduce birth inequities. So instances where families feel less heard in terms of their wants and needs, that disparity is reduced by hiring a doula. So there's lots of incredible evidence out there as to why a doula adds to your team. It's one of the many reasons why reimbursement is happening in many states at a rapid pace. And Rhode Island has, thanks to the Rhode Island Birth Worker Cooperative, has one of the most progressive doula reimbursement bills in the country and is a model for policy. Next slide, please. So what I like to think of in terms of birth is that bundling your care, meaning that you're collecting a group of evidence-based strategies that in terms of strategies that are known individually to work, but when you put them together, they're bundled to provide even better care. And to me, that value, quality, and equity bundle means including midwifery care as appropriate. I happen to think that at Women and Infants, we get to work with the best physician consultants and a world-class maternal fetal medicine team in terms of who we can consult with. So I feel very confident when you come to a midwife in my hospital that when you come outside our scope or when expert consultations is needed and complications, that we have access to incredible resources. Community education, there is nothing better than getting education both within and with outside your healthcare team to make sure that it's non-biased. We have lots of resources in the community for community education. Urban Perinatal Education Center is a great example. There's lots and lots of resources that we're going to share with you at the end of my particular talk. Doula support, once again, I'm going to provide resources on how to access a doula support and shared decision making. We are in the process now of implementing a shared decision making whiteboard at Women and Infants Hospital, teaching providers, starting with our residents, and it's thanks a lot of the work that Anna Sophia has done in our resident education program, how to talk to patients about their choices in a way that is equitable and allows for a lot of shared decision making. And that's a skill, and that's something that we're working on, as well as how to provide this information in a trauma sensitive way. We know that many, many families come to any healthcare experience with their own history of violence, with trauma, with not good experiences with the healthcare system. So those are ways in which we're trying to improve equity and value, is by teaching our newest providers, our residents, how to provide trauma-informed shared decision-making. Next slide, please. So birth is emotional, and I love this slide, and I love this quote from Lenore Friedrich. They shouted and I shouted, not because of the pain, but because something elemental and stupendous was happening and I was in on it. The thing that I love about being at birth is just that emotion, that the relationships, the knowing that the birthing individual is bringing forth new life into the world. And that's why when we think about pain and coping in childbirth, it's different than other types of pain because it's something very natural and beautiful is coming forth out of the pain. So something that we use to assess pain in labor is a more holistic way called the coping with labor scale. So we're looking at the birthing individual, we're looking at, are they coping or are they not coping? So coping looks like rhythmic breathing. Coping looks like support. Coping looks like, it does look like noise, but it looks very different than when somebody is anxious and maybe wants, or in their birth plan is to have not a pharmacologic support. So we have support for that too. We have epidurals, we have pain relief, we have nitrous oxide. So knowing what your coping strategies prior to birth are is a really important aspect of doula care, of really understanding what you are hoping for. If you're the type of person that has prepared for a marathon and you know that you can do that, birth is the same way, preparing for what it might feel like, what different experiences might look like, and then again, surrounding yourself with a team that understands your wishes and is there for you and present at every step of the way. And these are just some really nice pictures of what support looks like, what bonding might look like. And I love the picture in the lower right of, some really nice hands-on labor support techniques that probably taken away this person's back pain. Next slide, please. So this is a quote from a book that I read in a sociology class in 1983 in my liberal arts college, that birth is not about making babies, it's about making mothers strong, confident, capable mothers who trust themselves and power in their inner strength. And this is by a sociologist named Barbara Katz Rothman that wrote a book to me that changed my life called Women in Power in the Birthplace. And there are power dynamics in the birthplace, particularly if you give birth in a hospital. So having your support team around you helps you negotiate those power dynamics in a way that is best for you, in a way that honors your preferences, in a way that honors your family and honors that transition in the most sensitive, supportive way possible, so that you embark on your journey as a parent in a confident, calm way that makes you believe that you can do it, but also helps you know, what are my resources? What if I'm feeling overwhelmed? Who do I call? Who's on my team? And how do I make sure that this transition is as healthy and optimal as possible? It's like Anna Sophia said, dream for a joyful, beautiful transition to parenthood.